With a new baby in your home, it's important to know how to care for them. Here are some tips to keep in mind. When traveling in a vehicle, be sure your car seat is the right size and is installed correctly. Ask your provider about classes on car seat installation in your community or have it examined by a certified professional. If you share a bed with your baby, take basic steps to ensure it's safe. Avoid using comforters, heavy blankets, pillows, water beds, and beanbag chairs. Call your primary care center if your baby has a temperature over 100.2 degrees. If you don't know how to take your baby's temperature, ask your provider. Your baby is smaller than you, so be sure to keep them dressed appropriately. One more layer than what you wear. It is best to breastfeed your child for 6 months. This protects them from ear infections, colds, and pneumonia. It also lowers the risk of breast and ovarian cancer in the mother. Feeling moody or depressed after giving birth is normal, but if you continue to feel that way after 2 weeks, speak with your provider. If you have questions, please contact your primary care provider. Caring for an infant is a big job. Here are some tips to keep in mind. Babies must never be shaken. Everyone who handles your baby needs to understand, even playfully tossing a baby in the air can have serious consequences. Symptoms of shaken baby syndrome may include convulsions, decreased alertness, pale or bluish skin, not breathing, and vomiting. Don't ever leave your baby alone. And make sure everyone taking care of your child knows infant CPR and has emergency contact information. Always wash your hands after changing your baby's diaper and prior to breastfeeding. Thorough hand washing prevents infections. It is never too early to start reading and playing with your baby. Reading and direct human interaction is essential for brain development and bonding. Remember, television does not help brain development. If you have questions, please contact your primary care provider. As your infant gets older, there are new things to be aware of. Infants are curious. Keep harmful objects away from them, including hot liquids. Never smoke around your child. Smoke can weaken their lungs, harm their hearing, and increase the risk of sudden infant death syndrome. Smoke detectors save lives and give you extra time to evacuate your family. Make sure yours work. An easy way to remember to change the batteries is to do it every daylight savings change. The best food for your baby is breast milk. At this age, avoid feeding your baby water or juice because there's no nutrition in water and juice is too sugary. When bottle feeding, do not prop the bottle. Always hold it and keep it at an angle. Smiling and cooing with your baby is important. It helps develop their brain, their social behaviors, and strengthen your overall connection. Be sure to spend tummy time with your baby. Monitor time on their belly helps them develop physically. If you have questions, please contact your primary care provider. When your infant is 6 weeks to 2 months old, there are new things for caregivers to know. Be sure your child has age-appropriate toys. The wrong toys can be harmful, and too many toys around your infant can be dangerous. Limit the time your baby spends in their playpen. Toys are great, but cuddling and family interaction is better. And remember, never leave your baby alone with a pet. Even a loving pet can hurt your child. Breastfeeding is the best source of nutrition for your infant. If you formula feed your child, or if they need extra vitamin D, follow the mixing directions closely. It is important to pay attention to your child's bowel movements as an indicator of overall health. Babies may not poop for several days at a time due to a change in their food, formula, or breast milk. However, frequency is less important than consistency. Hard stool may indicate your child is constipated. Constipation is uncommon in breastfed babies and may indicate insufficient milk production by the mother. If you have questions, please contact your primary care provider. At 4 months, your baby is hitting new milestones, and there are things to be aware of as a caregiver. Babies learn new behaviors every day. They can likely roll over on their own now, which means they can roll right off couches and beds. Make sure someone is watching over your child at all times. Look for signs that your baby is ready to start eating solid foods. Can they hold their head up unassisted? Are they showing interest in food? Speak with your provider about the best ways to introduce your little one to solid foods. Your baby may be developing teeth now. It's important to keep their mouth and gums clean. You can use a wet washcloth or a finger brush. Your baby should always be laid down on their back. Lay them on a firm mattress and remove toys and extra blankets from their crib. Babies sleep a lot. 16 hours a day is not unusual. Sleep is important for brain development. If you have questions, please contact your primary care provider. Your baby is more active now. It's time to brush up on safety facts and baby-proof your home. Beware of your child pulling on cords, and be sure to cover electrical outlets. Store all drugs, cleaners, and poisonous plants out of their reach. Put a gate on your stairs, and keep all choking items away from them, such as balloons, plastic wrappers, bags, and small objects. Walkers are not recommended at this age. Swings, saucers, and bouncers are safer. Your baby may be developing new eating habits. They can drink water now, but no more than 4 ounces per day. When eating solids, your baby needs to be fed with a spoon, not a bottle. Make sure your baby is sitting upright and supported. Hold their head as they swallow or refuse foods. Do not put your baby in bed with their bottle. Use reading and playtime to connect with your baby. Reading is important for their brain development. Do this with them often. Limit TV to under 1 hour per day. If you have questions, please contact your primary care provider.